Good evening, everybody. I'm back again after a real long time. I'm perfectly well after being stuck with dengue. All well now, no weakness. I've been getting loads of messages, but all well. All has been great from the day I've been discharged. And yes, have been waiting to do this specific webinar with Dr. Mona Shah, especially because we all mothers are stressed with feeding. We might make delicious food, but when we bring that plate in front of our toddlers, babies, they just want to get out of the chair or they want us to go behind them to feed them. And it gets so difficult in the life of the mothers. I have mothers telling me that they have crying days where they are crying because their babies are not eating. So here is a special webinar just for all of you. And let me now take the opportunity to introduce Dr. Mona Shah. Before that, welcome, Doctor.
Thank you. Thank you. Thank you so much for inviting me.
And here we go. Dr. Mona Shah channelizes her vast experience of 30 plus years as an occupational therapist, along with her special skill set to guide and train therapists, interns, teachers, and social organizations on various aspects of child development with the goal to identify, treat, and transform disabilities to abilities in children for a healthier and happier society. Having obtained an MA degree in psychology, Dr. Mona Shah also specializes in early intervention, craniosacral therapy, sensory integration, brain gym exercise, SOS feeding approach, and diet planning towards a healthy lifestyle. Dr. Mona Shah is a registered member of All India Occupational and Rehabilitation Association. Her passion and desire to provide nothing but the best treatment has resulted in her continuously enhancing her skills set by taking up specialized courses in India and in the US. She is the head of Anshu, a child development and adult physiotherapy center at Kasturba Health Society in Mumbai, with the vision to excel in service, expand in love, and advance in knowledge. Anshu treats all its patients equally. Welcome, Doctor, again.
Thank you so much, Sakrasta. It was really a wonderful introduction. And I also, after a long time, I could revise the whole thing of my journey. Thanks. Thanks a lot.
Doctor, is there anything that you would like to add in, which I have not shared?
So everything will come over a talk. Please go ahead.
So she is not just doctor, but she is also a mother. And with 30 years of experience, she is also a grandmother.
Yes.
Am I right?
That's perfect.
Okay. So that's what I think I've missed. And that's very important to add in for sure. Now, going to the first question, Doctor. Why has it become important to discuss about feeding? Why do you think this has become like the talk of the town? Everybody is wondering, oh, when the feeding starts, everybody's worried. There is a lot of chaos in this space now.
So, first of all, thank you so much for inviting me. And today we are touch basing about the very important subject for the young mothers, each and every mother who has been always stressed about it. And Rashmita, you started with very apt question. Why should we discuss? Do you really know our mothers or a grandmom ever discussed about a feeding for kids? Never, because they never had this issue. And generally, also, when we talk about the seniors, they always tell us, kids eat. You don't have to worry about it. If they are hungry, they eat. But the time and everything has changed. The prevalence of feeding difficulties has really increased. It has gone from 25% to almost 50% for the normal developing children. And for this, like specifically somebody who has a problem or a developmental disability, it reaches from at almost 70 to 80% feeding difficulties. So definitely it is a very apt subject to discuss with, because a lot of parents has a concern about it. Now we are discussing, then it can vary from very mild problem to a severe problem. So we need to discuss eventually, but as you mentioned it, it's a very apt subject to discuss, and it's a problem now everybody is facing it. So what I can understand, the major reason for this is it could be the change of the societal structure, environmental structure, at the same time not having the young mothers are getting conflicted between the knowledge they get from the Google without understanding. Somewhere they are getting confused. What should they listen from their mother, or they should listen to Google, and how much balance they should keep? I think there is a lot of confusion in their mind, and that is why it's a subject very important for everyone.
Sure, sure. So going to the next set of questions, the second one is, what are the feeding problems in young children? So when I'm talking young children, doctor, you can help me with right from infants to babies, and then maybe toddlers and older. I'm sure because we'll have different audience watching this video, so it'll help us understand, okay, what kind of problems in every stage of a child's life.
Yeah, so as I mentioned it, the problems can be from a mild to severe. So feeding problems, as you wanted to understand from each and every one, infant to this, if we generally say it's from the young children, can be common and are often a source of concern for parents and as well as caregivers. So these issues range from picky eating, which could be easily managed, like that lot of discussion we can do about picky eating, to more serious feeding disorders. So it be to name it, like when you say the different feeds, first of all, how to start, whether they are eating, you start from the very young kids. And I think we are going to discuss, everybody's a lot of interest on how to start from the solid food, that we can eventually discuss it out. From picky eating to slow weight gains, many of the times the parents are concerned. The problem is the children are not getting enough weight. Food allergies and sensitivities, these are the common problems. There is more elaborate is the medical conditions. So some of the medical conditions such as GERD response and the reflexes, gagging reflex and choking, tongue tight. Ankyloglossis is a condition where the tongue is tight and it restricts the range of motion of the tongue, and it becomes very difficult for kids to swallow. So if you name it as a medical condition, there are lots of sensory issues. And again, what I am talking as the environment and the different upbringing style has changed over here. The children are having a lot of sensory issues, and that sensory issues like tactile sensitivity really affects the children in the feeding. Oral motor skills, again, if they are not that strong, it can get affected. Finally, the behavior issues. So even the psychological part and refusal to self-feed, they don't want to eat on their own. So these are to name the few of the problems which children face. If we want to segregate, it's like in a different umbrella terms, it's like medical, it's neurological, behavioral, psychological, and sensory problem. Now, if you want to discuss about from very young kids to the elder kids, what we have seen is when a child has been a very young, the sensory part plays the major issue. If you are talking about the infant, if they don't have any medical condition, we separate out the medical condition who they have a problem. There are in one part, there are children who has a genuine medical concerns and a feeding difficulty. The other side, there are children, everything is normal, but then also they don't eat. They are the normal, typically developing children, but then also they don't eat. The feeding is the only issue with them. So for them, the sensory issues takes a lot of weightage, like the most of them, 80% of them have underlying sensory issues, and they don't have oromotor strength. As children grows, the environment, psychological, behavioral aspect takes over it because they have different understanding. Their cognitive functions keeps developing, and they have an interpretation on the way how the mothers are feeding them or the caregivers are feeding them. And they interpret over there They might get stressed, or if their feeding experience is not good. And eventually the environment and nutrition, when you are talking about the kids, if we talk about 7, 8, 9, 10, exposure, family environment, the family habit, what kind of culture they are setting up. So everything together, it becomes the most important thing. And these are, I think, the major problems with the children overfeeding.
So it's not just one factor. So I think it's not physical, but it's a overall aspect, just like an overall development of a child impacts everything. So I usually tell this doctor to the mother that when they come to me and ask me, give me recommendation, I tell them that it is not just your role. It's your entire people who are part in that family, because the child is learning each and everything from everybody. So you don't know what is the child absorbing and how is the child responding to that absorbed knowledge.
Absolutely. The family environment is the most important thing when we are talking about the typical developing children. We are not discussing a typical if we keep it aside, but for the typical developing children, it's always important what is the atmosphere in the family.
So the third question, doctor, that I have is, what, as per you, is the common mistakes done by most parents when starting solids to babies? This is my favorite question.
Yeah, and I think you're doing a wonderful job by helping them how to start solid and how to get them used to it.
Thank you.
I think that's the most, most of your followers are young mothers who wants a specific guidelines how to do this. Now, Rashmita, you are working so much. What do you think? I want to ask you one question. Is it eating or feeding is the most simplest thing? What is your opinion for anybody?
Is it the simplest thing?
Yeah. Is it like it comes naturally, how it's like how we start walking and doing and eating also, it should become naturally with kids. What is your opinion on that?
What I know is that if the child has to prefer over sleep over eating, the child will sleep. But if a child wants to really eat something, they will eat. That's why I feel it is a natural instinct. Whenever they want to eat, they will eat. But if you force it, they may not eat. That's what I feel, and that's what I felt with both Angela and Azria.
Yeah. So though it looks like natural, but you believe it or not, eating is one of the most complex physical tasks we engage in. It involves every organ system, and each system must work simultaneously. So it involves 8 sensory systems. So all the sensory systems should be at the app. Swallowing involves 26 muscles and 6 cranial nerves. So just to brief you, like so much of the integration of all the functions is required if anybody wants to eat and swallow food. So it can be a challenging task for some of the children. So basically, as a professional, I come across over here when it becomes a challenging, why it's a challenging. So for everybody, like a different thing, as I'm an occupational therapist working, everything like children goes to school, they should write. So you feel that handwriting should come naturally. That way you feel feeding should come naturally. But like from the starting of the breastfeeding, the sucking reflex should be proper, then only a child can latch on the mother's breast. So there are multiple reflexes. It should be in place for a child to eat normally and swallow it. So first of all, we need to do this, that it's not that easy. Okay. Now, other thing is to answer your question about the solid food. So again, introducing solid food is always a challenge, and mothers has a lot of different thinking, what to start, how to start, and different people has a different guidelines on that. But it is a very important milestone in child's upbringing. So first of all, if we want to discuss, we should start off with timing. When should we start the solid? So usually if a child is of typically good developing, it can be start by 5.5 to 6 months of the age. So that's the correct age to start. This is the guideline by American Academy of Pediatricians. So they say, then also I would suggest if your child has some delayed milestone or something, you should try and have an opinion of your own pediatrician before you just start giving them the solid food. Now, how do you understand whether your child is ready to start with the solid food? So usually by 6 months, 5.5 months, you should first start understanding and getting the clues. Now my child is ready for the solid start if you were only breastfeeding them. So what we are discussing now first is for the mothers who has been purely, the child has been only purely on the breastfeed and they have not given anything else. Okay. Now, the other timeline, as I am mentioning, is signs to readiness. Child can sit with support. So that is one mark that you will understand that with support, he has a relatively good balance. You have a feeding chair with the armrest support. Their foot should be supported well. I prefer, we always tell them 90, 90 and 90. So that's the ideal position for them to start. The back support should be there. Child should not be hanging. They should not be sleeping. Their thighs and the knee should again then rest. It's a posture called 90, 90, 90. That is the most important posture for anyone to start for the feeding. Ideally speaking, the foot should be resting. Okay, so the time we have discussed, the readiness for the child should be ready to set support because their neck they are holding, then only they can sit with the support. So good neck holding and the supportive sitting. So that is, then comes the solid start. So how do you start? You have to introduce with a very gradual introduction. The important thing is give them enough exposure to feeding. Where most of the parents or goes wrong is they start with some food, the child they have not given enough time to explore. They don't know what is it. They are not allowing to play with the food. So on the chair, the most important thing is for some days, you introduce them to typical some kind of textures and let them understand, let it go around their mouth. They can touch them, they can feel them. They should understand it as if it's their playing instrument. And by this month, 5.5 to 6, most of the children has learned to keep their toys and everything in the mouth. So they are mouthing has started. So automatically, if they have something on their table or a tray, they try to put it and they try to put their fingers or a thumb on their mouth. So that reflex is there because they have been putting always their toys in the mouth. And it is a pattern during that month. They definitely put it. So first of all, you should not restrict. Definitely sanitize your toys and allow them to put it in the mouth. So that is another milestone and that is a learning. So whatever coming on the tray, they can pick up and they can put it in the mouth. So the time we have discussed, the posture we have discussed, gradual introduction, start with a very semi-solid kind of cereal and little blend food. Don't worry about anything which don't have salt or sugar. I don't think so. Children needs that. You can even, if nowadays the breastfeed, everybody is having pump around them, they can pump it. They can add some of their milk with their cereal to just because they are used to that breast milk and then start with that. When you take the spoon or anything, the child should come forward and they should open their mouth. Then you understand the readiness that they are ready to put something in their mouth. So that is what is the gradual start. Slowly and steadily you need to start this. As I mentioned, always start with a very small amount. Don't force from the very first day. You should not think that child will have a full meal and they ate only 4 spoons. So I think you had a late night or not sleep.
So that's our usual question, doctor.
Come
Because
with us.
we talk about how much quantity. So there have been calls that I do in Ask Me Anything where the mother is already feeding a child a one full chapati, which an adult eats. And in the call, I tell you will have to bring it down.
Yeah.
And the mother is wondering, saying that how will it be enough? Because the mother is taking 1 hour to finish that one full roti. I tell them saying that no, the feeding time has to be less.
It cannot be more. So, Rashmita, as we are discussing first, let's go stepwise of the solid. The chapati will not come over there. So what I was suggesting is start with a very small, and your question is very apt. How much? What do you mean by small quantity? So here you have to pay attention to baby's cues. So allow them that whether they are opening, they are saying, see, if you closely observe, they have their liking and disliking. You can watch like after 3 or 4 spoons, if they reject it, don't force feed. It's okay because you are starting additionally. You are having supplement of a breast milk with it. You are just introducing. So give them enough time. It's purely on the baby's cues. So you need to don't distract them. Their attention has to be on the food. If their attention is on the food, they'll definitely give you a cue that I'm okay now, I don't want this. So feeding technique is always like this. And at the same time, as you slowly increase, like as we are going towards solid, when they go for the semi-solid, they you have given purees, introduce different fruits, starts with the fruits like apple, banana, whatever the seasonal fruit is there, you can mash and then give it. Initially, very simple, liquid, little thin. Then you can go with the mashed food, and then you can definitely go over a period like after 7, 8, 9 months with the finely chopped food or anything. Every time you have to increase, like after every third day, introduce the new food, but every time on the first go you have to introduce only one food and wait for 2 to 3 days whether that's getting digested. If there is any allergies happening, your child is comfortable with that, you have to be closely observing from in the beginning. I always prefer caregivers has to be the close family members and not the somebody who is a helping hand. You can watch your child, you can see whether they are liking, what is their reaction, more than liking the solid food, how they are digesting it, whether it's gulping it. Very important is after like maybe after a month or 2 months after you have introduced different kind of fruits and vegetables, and then slowly like in India we introduce khichdi, mashed one. I prefer never mix, see grind. Always. I think that's the major mistake mothers do. They put it in the mixie. You can just scream it. You can just do it with your spoon and churn it, or you can just bite it and you can make it little paste. And then slowly, slowly, once you start giving them mixie, then mixie food, they will not take it further. It becomes very difficult if it's a little big particle. So they need to learn them after they have started with little enough quantity of solid food. Introduce a sip of water within a cup, introduce with the water also, and I'm sure they will like it. You have to give them water once you start with the solid food. After that, so that's how slowly and steadily from fruits to vegetables, and then you go further. After around 1.5 to 2 months, when you are starting talking about the solid, you can give them little hard munchables, but it has to be very important that you are observing them. It should not go in their throat and it should not choke them. So very importantly, but they should know because hard munchables again develop their oromotor strength. And unless they will not have enough oromotor strength, they'll not be able to bite. So that is how is the process of slowly, slowly building over the solid food. Always check out for the allergies. Wait, again, I'm repeating, don't jump on starting the full platter. Introduce one food every time. Be patient. Always breastfeeding needs to be continued at least as an APA guidelines till 12 months, but at least 9, 10, 11 months in conjunction with the solid start. You have to continue having your breast milk. You should make sure that because your child has started eating, your breast milk production should not reduce. You can start pumping because your child is also growing. You should be very vigilant enough to that. And the most important thing is patience and persistence. I think the most important, very slowly, keep introducing them, don't get demotivated, showcase them, exaggerated positive approach while you are feeding. Wow, nice. How if your child is been started sitting and walking and playing and you just clap your hand, the similar kind of response should come when your child takes 1 spoon of solid. They start feeling it. That's something which is very enjoyable and everybody around is happy. So I think that's how, if I've missed out, you can ask me on this, any question.
Just to add on, so Doctor, I do share the same thing, that patience and persistence will take us long way as mothers. And just as you said, just as they do all these milestones, right, from walking, we show them so much of excitement. So just to share, so when as he was potty trained, what we did was once he would do his either his pee pee or potty on the potty, it was like a birthday celebration. Like all of us would come and clap for him. And
Yes.
that's what really motivated him. Like, he was so happy, and he would even call us, like, call others, cheer me up. So every milestone needs their attention. We need to give them a special, feeling that, it's something special. Then gradually it will happen. It's not going to quickly get into a habit that, they're going to not be like adults, sit and eat. That's not something that's going to happen.
Definitely the reward, not like a physical reward, but a smile or a gesture, well done, good, happy movement. Every time they eat, you need to give them. And I'm sure with that experience, and wait for them to get settled. It's not necessary they are going to eat everything. Positioning is very important, how you are making your child feed, and initiation from a child. So they should come forward, try to encourage them self-feed, let them play around, messy around. They will might drop a lot of things. It will be, your cleaning work will might increase, but that will take you to a long way because they will be interested and you are giving them lot of sensory feedback.
Doctor, the fourth question is, who as per you is a picky eater? Because now I feel every mother wants to tag the child as a picky eater. And that's becoming like, every child has become a picky eater. So can you
You
define?
should ask that mothers only. Do they know what is picky eater? So just to name, if I go by the guidelines of a definition, so see, there are two types of problematic child. One is picky eater, one is the problem feeders. Okay, so picky eaters is something which is a milder version and which can be manageable, and there are problem feeders. If I differentiate both together, so picky eaters classically it eats ranges of food they will eat is more or less equal to 30 items. That is called picky eaters or more. At the same time, problem feeders eats less than 20 items. So that's how the major definition wise. Picky eaters, sometimes they lose interest in the food due to some kind of food gag, or and sometimes as you mentioned, that suddenly they stop eating due to something, but then most of the time they regain this in a couple of weeks. Again, their interest can be regenerated. Food gag here in problem feeders, once you have lost, it cannot be again replenished. So this is a major difference between that. Picky eaters able to tolerate the new food or even can touch most of the food. The touch is not that difficult, but for the problem feeders, it's a hell of a work. They cannot touch or swallow or take it over there. It's a big difficulty for them. So they are the problem feeders. Of they can eat one food of all the textures, picky eaters. Like if you give them in a different format, they can eat. The textures doesn't matter to picky eaters. The refusal is definitely on texture for the problem feeders. So
Okay.
to understand whether your child is really having a problem or is a picky eaters, these are the few remarks which can be differentiated. Picky eaters usually eats with the family and with the different set of food, but they have their own preferences. Here they will not eat at all. Picky eater, again, you can introduce 15 to 20 steps and little sometime you can do it. And here you need very elaborate reason. In 15 to 20 minutes also, you can make picky eater eat most of the food that you will not be able to make them eat. They picky eaters will not starve or make them ill because they are not eating. At the same time, problem feeders can starve themselves for not eating anything for 24 hours or 36 hours or 48 hours. And you really need medical intervention for that child because they just don't eat.
Okay.
So just to differentiate and give you a clear picture of what is a picky eater and what's the problem.
Got it. Got it. Going to the next, when feeding issues should be a cause of concern of parents, and what should be the approach that we need to look at?
So to give you brief, I explained you what could be the picky eaters and what are the problem feeders. If your child come across in the problem feeders when they are really not eating, they are not getting exposed, or it's a really major cause of concern. Again, we'll go back to first of all, if any of this thing is happening, we need to, or the cause of concern is medical intervention. As I always said, it needs to be evaluated through a pediatrician, through a ENT specialist for a tongue tied or a gastrointestinologist, that is there any underlying medical issue which is helping them. So that is a primary cause. Neurological, again, if there is any kind of sensory and neurological problem, if a child is not having good reflex, again I am mentioning it's a very complex act. Whether child has achieved that kind of milestone where they can eat, they can swallow, they can refuse, they can, so that is what is, again, it's a cause of concern and they should know this, they should approach. Sensory issues, feeding therapists, we can really check out. Now, when I have seen lot of kids, the parents understand only feeding is a concern, but when they come to me, there are a lot of underlying issues which parents will not come to know. And when it specially comes to somebody, when I want to introduce some of the atypical children, like it's not the developmental disorder, like the milestone, physical milestones are fine, but when you talk about the neurological milestone or autistic spectrum children or any kind of ADHD children, if the underlying concerns we don't know, then it is really difficult and you need to approach the professional occupational therapist or a feeding experts to understand whether is there anything underlying. Eventually, if you have not started, here I definitely want to mention about the stress level of mothers. I had a couple of mothers who had themselves said that breastfeeding for them child was so stressful. The environment, the family was very stressful. But the mother was always stressed while breastfeeding. So we definitely understand if the child has started with such a stressful emotions, the feeding is going to be a little concern. So all these factors really need to be considered and they should, if they feel any of this thing, the evaluation from a professional expert and an intervention should be very important.
Going to the last question before we go to the next segment, Doctor, is we would like you to share your experience with parents of children with feeding difficulties so that at least we have few examples because the mothers will be very confused in understanding whether my child has a problem or does not have a problem. To differentiate between, as you rightly said, whether my child is a picky eater or is a problem eater.
So to name it, Rashmita, there are different concerns. We have kids, 4-year-old, who is who is not taking any food. They are still bottle feed. They put everything in the bottle with not even sipper they take it. The nipple of the bottle they make hole bigger. So
Okay.
milk, nachni sattva, any kind of liquid and everything just mixy grind. It's been feeded. Still they are not trained child to sit and take milk. They have been
Okay.
feeding them in the sleeping position, and when we see such kind of children, then it's definitely a cause of concern. A 4-year child is not being trained to sit or by a feed. There are certain kids who has been like 4 and 5. We have patients coming over there. The child has been eating every single day just a ball of soup and a chapati soaked in the soup, and then had that has been the regularly every day same single soup, and definitely a cause of concern. There are sometimes parents come with the child is not having some regular food, roti, shak, bhaji, rice, they'll not eat, but they are okay to eat junk. They'll eat chips, they'll eat biscuits, they'll like this, but as soon as they will eat, they will not ready to eat. There are children parents coming with this, they just don't eat without having a screen time in front of them. There will be always mobile or some kind of distraction, and they have been feeding them. There are parents, the caretakers has been running around, taking them in their ground or going there. Child is running around and they are putting just food in their mouth. So I think all such cases are a cause of concern, and they should definitely have an opinion of experts.
So, Doctor, we are moving to the myth segment. So, I want you to bust few myths that is around feeding, which will help mothers. And one of the things that I want to pick after that is screen time distraction feeding. Because it's not just the millennial way of doing, the young mothers are doing, but I see that the young mothers telling me that the grandparents of the child telling them that if he's not eating, then show the screen. The guidance has become that now. Like, it's okay. Let he at least eat. So we'll come to that. Before that, over to you for the myths.
So there are lots of misconceptions, if we can say. First of all, the misconception is that it has to be, they have to eat roti, dal, bhat, shak. So meal has to be that only. So I sometimes say that it's not necessary if a child is not taking a piece of roti, not dipping in the dal and in the vegetable. You can smartly make your chapati, which will have dal or which will have your rajma or which will have, and make a nice roll kind of like Frankie kind of thing. It's easier to eat. So that becomes easier. It's not always necessary that they should spread out the separate thing and you should do it. I think that is a major misconception people has. Eventually, they can be trained, but instead of just forcing them to dip it, the nutritional value needs to be considered. So it is very important what kind of nutrition you are putting it with your child. So that is one very important thing. Sometimes they want to make it very healthy without oil, bland food. The child cannot have this. So this also doesn't work. It has to be a balance. It's not necessary they have to. When your child has certain preferences, it should be given alternative. Like as again we are saying, as a reinforcement. Certain kids, which I already mentioned, they don't want to eat roti and all. They are okay with chips. So what you have to do? Give one piece of roti with nice paratha or thepla and give one chip as a reinforcement. Banana chips can be given like this. It's equally healthy also. Again, 2 pieces of this and one chips, banana chips. So that way you can club it and then you can make your and their both of their and this, just to name it, they have the need of this biting of the crunchy food. That is their sensory needs. If we keep talking about the sensory, the whole session of the sensory needs, and that is why certain kids have a preference over crunchy food than the soft food. And it's not only when they are young. You, as an adult also, if you will see, lot of adults has a need for the crunchy food at the end of, unless and until they'll not have, like normally you don't like lot of people without papadam, they'll not have their food. So the papad has to be an integral part of their meal because they need that crunch in their food. So you need to understand that. Sometimes they always feel that whole grain foods, like it has to go like this and it has to be, as you were mentioning, it's a wholesome meal. So if you whole every time, if you will give so much of whole grain food, it's very difficult to digest. So you need to understand how it is giving. At the same time, the milk has to go. That is another myth that people say, if they are not drinking milk, what should we do? And nowadays, all the pediatricians and everybody has a guidelines that it's not necessary, but the calcium resource can be supplemented by other way. You can give them cheese, you can give them paneer, and you can make the parathas with different way, and then you can supplement that milk requirement in a different likable way. So these are the few of the myths. Yeah, sometimes they just prefer fruit juices instead of fruit. I definitely feel that juices should not be given. The raw fruits, with the cause of the fiber, it's easy to digestible. So these are the certain feeding habits. I think it should be taken care by parents. If you want to discuss anything, I'm open for that.
Sure, doctor. So thank you. Thank you specifically for all the pointers. So I have noted one of the things that you mentioned because that itself was new for me. You spoke about 8 senses get involved when we actually eat. So could you help me understand what are these 8 senses? Because I know we have senses, but I didn't know what are the 8. Yeah.
Yeah. So basically, all basic 5 senses, we have to look at, see, when it comes to, we have to look at the first of the food. You need to like that. Again, over there, you can introduce the different colored foods. Children likes colored food sometimes, and sometimes some of the children, they just don't accept some of the colors. So that is also one point of their rejection. They need to have a smell sense. So then food has a typical sense. The environment and the environmental sense, that also needs to be taken care. So the children difficult, they need to like the smell of the kids, the rejection of the food and the sensitivity. Some may see food like banana, papaya, mangoes. Many of them have a strong aversion towards such kind of food. So that is another sensory system which needs to. Tactile is the major sensory system which needs to be taken care, because the food textures needs to be, it's not only if you are eating with the spoon. When it comes to tactile, it's inside the mouth. So all the oromotor, the sensory system inside your mouth and in your hands, that both work separately. So that's how you need to understand that. At the same time, if the sensory system with the utensils, what you are using it, whether you are using steel spoon, whether you are using a silicone one, and when it's touching your mouth. So again, that sensory upgrade that needs to be integrated, that should be there. The smell, touch, tactile, skin touch, and then how we are sitting, the postural balance. So again, 3 sensory systems comes over there. So postural correction, you need your proprioception to sit erect and do it. You need to understand your body, where you are sitting, where you are stable, your joint, how it's moving, the movement, like picking up of the object, small joints to like the big joints, and it has to reach. All the sensory system should be integrated to pick up the food and go until reach till the mouth. So these are the all the sensory system which needs to be integrated.
So I just want to share this with the mothers. Like today itself, we had made khichdi and we had a lot of vegetables in it. And twice when I mean, during the entire meal of Azriel, there were 2 times that he gave it out. And as a mother, it's very important for you to observe and understand why. because the child is eating, but there are sometimes the child would give it out. So that's when I realized that whenever there was beans, he was putting it out. So that means he did not like the texture in his mouth. So what I did, I mashed it with the spoon and then I gave it. So that's what I even do, because he loves eating paratha as is. And whichever vegetable he says I don't want it, what I do is I hide it inside so that the first texture that gets into his mouth is the paratha. So that's just a tip for the mothers, that how I introduce food to Asriel, because it's not that there is no rejection. But as a mother, you have to figure out, okay, why is he rejecting? And then try different ways to, give the same food in a different way. Can be shape, can be taste, can be, in, as you said, banana chip, or inside
And
the paratha, or it's completely not visible.
just to give you a small tip, because you mentioned is, first of all, it is very important that you introduce food to your child instead of caregivers. You should be around. You are the primary person to be around, or anybody, caregivers should be a family members who should be observing them, not like you are watching something TV, they are watching TV, and then you are just feeding them. So you will not be able to reach any conclusion. When it comes to, we are talking about the sensory systems, it is like smell, major part. Sometimes, if just to give you a brief, you can, if you can, like a rose water or something, which I tell my parents to give it, sprinkle around the rose water in your house, the make the aroma of that, and you can check it out whether your child is comfortable, because there is one good smell which the child likes, and then they might not be uncomfortable with the other overpowering smell. So you need to be observant and modify the way your child needs with your intelligence. So I think then you can take it.
No, I agree, because when it comes to smell, every time when I make noodles, I have started using a plant-based soya sauce, and the smell
Mm.
of that itself is new to me. But
Mm.
so my daughter just does not want to eat it because of the smell. So I have yet to experiment making noodles with this new plant-based soy sauce, which I'm yet to see. Because she loves noodles, but it's just because of this smell that she's rejecting. So yeah, it's all about experimenting as well. So coming, doctor, I want you to give us like a 5 steps. I know it's not easy, but maybe a 5-step rule of all mothers who want to stop distraction feeding. How do we start?
So what do you mean by distraction feeding? Can
So
I?
when I'm saying distraction feeding is majority, I think a lot of mothers are feeding with the screen there. The child may not
Okay.
have any physical disabilities, nothing, but it's just that the mother is busy, or the reason they want some food to get into the stomach, so they have distracted the child, and now it's become a habit. From habit, it's gone to an addiction. The child is now addicted to phone, means food time. Food time means that's a synonym for them.
I think this is very common and very unfortunate of us. Though we are taking up everything from the Western culture, but this is absolutely not in sync with the Western culture, and this happens, I think, due to the availability of a lot of help around, and we have ample of time sitting and doing. First of all, the feeding process, like the meal time, how it should start. You should have a fixed routine for your child. The time has to be the fixed, like sleeping time, sitting time, food time, more or less. You have to have a schedule for them. It cannot vary anytime. Good sleep and good waking up time, everything, breakfast, lunch, dinner should be there. You need to talk about the food, what you are eating. You should be happy and describing your child before sitting. They should know what they are going to eat today when they are making it, so they mentally get prepared. Call them just 10 minutes before the meal time, prepare them, discuss with them, be a little excited about the what is going to come on your platter. So that is the most important second step. Third step is prepare them. Like, you can call them, you can involve them for setting up of the table, make some mattresses. It's night, it should be interesting for them. At the same time, it should not be disturbing. It should not have so much of motives. They'll be interested in that and not in the food, but they can get prepared themselves. Ask them to wash their hands. There should be a fixed routine to do that, that now let's start. It's a meal time. Then they all should sit and eat together. The family eating time should be together. Everybody should, when you are eating, you need to demonstrate the food, how you are eating, instead of distracting them to the screen time. So I think that's the fourth step. Then encourage them with, if you are eating, if your child is sitting in front of him and I'm enjoying khichdi today, it's a vegetable, and with that gesture the child looks at it. The fifth and the most important thing is, don't discuss likes and dislikes of your food habits in front of the kids. Most of the time, family I have seen, they have a lot of ifs and buts. They have it, I mean to say, for them to explore, and the whole family time should be good. So I think that should suffix good instead of just distracting them.
Sure. I have a participant. If you have a question, could you share that on chat? Somebody with the Vivo V2312 login. If you have a question, please write that down on the chat. I'll go with the last question that I had. How do we identify, Doctor, the reflex problem?
Very young kids, what of times what happens, they gag and they reflux over there. So when they're very young, it might be initially for few months and eventually it settles down. So as they are young, we give them enough time to burp themselves, the air should come out and the reflex should settle. If it doesn't settle and if it's very severe and the child keeps throwing, vomiting, the reflex vomit is usually, it's far. It's like it doesn't, your clothes didn't get bad. It just 1 feet away. It just throws throws food out of your mouth, or any of the milk, it goes out, then it's a reflex. If it happens occasionally, it's not a major concern. Child eventually settles down. But if it's too much and it's not keeping your child completely, like weight gain is not fine and it's not comfortable, then you need to start with the pediatrician's help, some kind of drops or medicine which will settle down the reflex.
I hear a lot of mothers. One is completely grind and give the food. Second is they only rely on giving khichdi for like good 6 months. And they don't want to give any textures. I would say, if I have to sum it, the mothers are scared because they are not with their parents, nuclear families. They are reading about baby led weaning. They have not seen any child at their home upbringing, because again, it wasn't like, even ours is a nuclear family, right? So there's a lot of scaredness in the mothers, that what if my baby chokes? So instead of choking, I'll give always soft food, or I'll give mixer grinder food. At least, there's no risk to my child. So how do we get this fear out of the mother?
So absolutely, it's more of mothers or the caregivers' fear that goes in the children. So first of all, you should be well read, you should be well aware, get enough information and take a little extra step to understand the how your child is growing. Again, we discussed in detail about the introduction of the solid food. So if you are introducing it step by step, then there should not be any problem. You need to devote some time. And mixie grind, I absolutely feel that you should never mixie food from the starting. You can just hand churn, you can just mash your food with your fingers or with your this, but mixie should not be introduced for a typically developing child. See, when we are talking about it, it's about a normal and typical development child, as we have already discussed their milestones. So then there is no need. Once you start that habit, it becomes difficult to win off for them. And as I'm mentioning, as the child, if it's normally developing, by 8 and 9, their cognitive functions are much higher. They will not accept change that easily if you have always mixy grind, and suddenly one fine day, if you are giving them good non-mixy food, they are going to reject. But then if you have done that mistake, then slowly you have to introduce it in a small amount like this hand mashed, and then you can take care of it. It will take little time to change over, but somewhere you need to be doing that continuously. And again, as we said, perseverance and constant patience has to be there. You cannot expect, if your child is habituated of eating the mixture grind food on the very first day, you cannot expect them. But you need to be observant, you need to be giving them slow. The spoon should be proper, and slowly teach them how to use their swallow reflex, I think, and they can take care.
Any message from your end before we end? We're almost coming to the end of the session.
So I think the concluding remark from my side is always take, all these guidelines are general. If you have any kind of problem, it's always advisable to consult a pediatrician and do it. Don't just follow instructions without you understanding your child. Don't try and change things which you are not sure of. Choose one item at a time when you are introducing. Your solid start for the young mothers should be a very important subject and needs to be understood well. The whole process of introducing food to children has to be very pleasant experience. If you are not able to give a child a happy moment while feeding, that is what the problem starts. So I think the atmosphere, good role model, yourself and as a family, and systematic, like what we are always discussing. And I am a certified feeding therapist of sequential oral sensory feeding approach. It is called SOS. So that has a total taking care of how do you feed your child, and if it's a picky eater or a problem eater, how can you make slow and steady changes, and every child can be helped to make a change and be a successful eater, and they can gain weight. So I think that's all from my side.
Thank you, doctor, for being here. And thank you for all the things that you've shared. I hope mothers who are watching should action slowly to get the desired results that they want, because feeding is a stressful aspect, but before getting there, I think you have to calm down, manage your stress, be patient, be persistent, take one step at a time. You can have one meal of the day started to change the problem that you're facing. Maybe if it's screen time, then start with the smallest meal. It can be the snack without the screen time. So what I would like to end is, I've been trying my best to reach out to a lot of mothers who are expecting, because I feel I don't want to reach you guys when you have made a mistake. So if you guys know your friends, families, anybody who is expecting, then connect them to us. Can be to doctors or anybody who actually is wanting to share, inputs, wanting to share recommendations, which can help them start right. Because I've been trying my best to connect to hospitals as well, so that I can reach out to the maternity section, talk to the mothers, because all of us are only concerned about the first, the baby is born, but after that there's a lot. And one of the most stressful milestones that mothers will face is at the 6th month. And instead of having that to be a stressful, I want it to be an amazing experience, just like how those 9 months have been. So that's a message that I want to leave it to my audience or anybody is listening today. And yes, doctor, you can connect me to hospitals so that I can talk to the mothers when they are there with their babies. And that's all from my end for today.
Thank you. Thank you, Rasmita, for this wonderful insight. And as mentioned, it whole feeding experience should be an enjoyable moment. The falling apart is very easy, but the important thing is coming back and trying with patience and working on this, and your children can be equally happy. Thank you.
Thank you. Thank you, doctor.